Well, good afternoon, everybody. My name is Daniel Dacombe, and I work for the Addictions Foundation Manitoba. I'm here to welcome you all to today's booster session, Managing COVID-19 Information Overload. Just a little bit about the booster sessions, if you weren't aware. COVID-19 has challenged health system workers and changed how we conduct ourselves in the workplace, in our homes, and in our social connections. And these changes do feel overwhelming sometimes. To support health system workers, Shared Health and our Psychological Health and Safety Committee partners have brought together these skilled trainers from across the province to facilitate a number of staff booster sessions. And that's what we're going to be doing here today. If you are observing this on March 15th, then you are attending the live session, and there will be opportunities to ask questions at the end. On the right-hand side of your screen is the GoToWebinar dashboard, and you can use the questions panel to ask questions, and at the end we'll be answering them. If you're watching at any other time, either one of the rebroadcast sessions or the video on demand, then obviously there won't be an opportunity to ask questions at the end, but there will be opportunities for further booster sessions in the future. A bit about this session in particular, the global impact of COVID-19 and the urgent need to develop and disseminate effective prevention, mitigation, and treatment strategies has led to an unparalleled deluge of COVID-19 related information on a daily basis. Healthcare providers are uniquely impacted by information overload as they often are required to process a high volume of information related to COVID-19 as part of their work, including updates to best practices, changes in local regulations, and institutional protocols. Many also feel an obligation to address misinformation to help inform their social networks and communities. This session will focus on concrete strategies for managing COVID information overload in the healthcare context. We'll also offer some tips on how to meaningfully disconnect to help maintain our psychological health and resilience. I'm very excited today to welcome Dr. Maxine Holmquist, who is an associate professor in the Department of Clinical Health Psychology at the University of Manitoba. She serves as the faculty lead for health psychology for undergraduate medical education as a long-standing clinical teacher in the Max Rady College of Medicine, where she's worked with trainees in primary care and hospital settings. She is a past chair of the clinical section of the Canadian Psychological Association and has been working with a national team of experts building a web-based resource for evidence-based practice in psychology. Her research interests include the primary prevention of mental health disorders, psychological influences on health behavior, improving healthcare delivery, interprofessional education, and collaborative care. Thank you so much for being here with us today, and I'll turn it over to Dr. Holmquist.
Great. Okay. And thank you so much for that introduction. And I realized listening to my bio there that although I certainly do research and I do a lot of teaching, the majority of my time is as a healthcare worker, that I spend the bulk of my time at Health Sciences Center doing adult outpatient treatment and working with patients. And that's really where my first love is. And yet somehow I don't think that was really emphasized in the introduction. So my goal for today is to introduce this concept of information overload. I want to talk about some of the reasons why this is a particular challenge for healthcare providers, even in non-pandemic times. And we know that it has only been exacerbated over the past year. And then I want to offer some strategies that we might consider to help managing this flow of information, including the importance of sometimes stepping out of the flow in order to recharge ourselves. So Dr. Christina Maslach, one of the first academic psychologists to really rigorously study the phenomenon of burnout, defines overload as a situation where job demands exceed human limits. So much like the truck in this picture, when we're dealing with information overload, we're in a state where the intensity or the amount of information exceeds our ability or capacity to process it. And this causes us to become less efficient in our work, to sometimes put off making decisions or to make decisions that are poorer quality, to become distracted from core aspects of our job, and often to experience increases in anxiety, stress, fatigue, and even worsening of our own overall health. Now, information overload can have many causes. So the first is simply a matter of volume. So with the advent of the internet and smartphones, it's never been easier to access and disseminate health-related information in real time. However, even as early as 1986, the World Health Organization recognized that for most citizens, our efficiency in using this information is really hampered by the amount of potentially relevant and useful information that's available to us. Now, the key word in that sentence is potentially. So When we have effective filters in place, this can help us to reduce the burden of trying to process all that information and allows us to prioritize and allocate our attention and our resources more appropriately. With COVID-19, an additional complication is that really critical developments and health updates often get lost in this deluge of information that is inaccurate, misleading, and sometimes even actively harmful. And that really impacts our abilities to do our jobs and to care for ourselves and for our patients. So all of this puts healthcare workers in a bit of a precarious situation. We know that we're often required to understand information about COVID-19 for our work, even if it's just knowing what we need to do in order to get into our buildings. Many of us are also having to absorb rapidly changing protocols and trying to anticipate what will be necessary in a future where there's still quite a high degree of uncertainty. And many healthcare workers feel that they have an ethical or professional responsibility to share or promote accurate information and to debunk inaccurate information whenever possible. So for some of us, this happens in the context of trying to support informed decision making with our patients. And in other cases, it happens online, where for some healthcare providers, this debunking of misinformation has really turned into almost a second job. We know that healthcare workers often can also face some pressure from friends or family members who may think that we have access to special or inside information or may expect us to weigh in every time there's an announcement or a recent news article. And there's a cost to all of this. This unrelenting focus on COVID-19 can be upsetting, and it certainly is mentally exhausting. So let's go through each of these challenges in a little bit more detail. This graph shows peer-reviewed publications generated in the first 4 months after COVID-19 was defined as a disease entity. So by comparison, MERS and SARS generated just 3.6% and 0.75% as many publications in their first 4 months. And of course, we know there are many, many thousands of more articles now. Where I work at HSC, the first COVID-19 email was sent on January 28th, 2020. And over the course of last year, over 500 emails were sent on COVID-19 related matters alone, which is about a five-fold increase over pre-pandemic levels. On top of all of this, we have been inundated with wall-to-wall coverage of COVID-19 related stories in the news and popular press, as well as on social media. So for many healthcare workers, this has really had the effect of being a bit like drinking from a fire hose. And even prior to COVID-19, the issue of information overload in healthcare was well recognized as a concern. So a central problem that's been identified is that our strategies for evaluating and sorting information really haven't evolved at the same rate as the means of producing and sharing information. And when we see this especially online, where high quality evidence-based information has to compete for visibility with lower quality information, some of which may actually have better production value. This is really complicated by the fact that our online information ecosystem is optimized for speed and impact, so clicks, rather than for truth or quality or accuracy. So one strategy to try to wade through all of this is to use what are called filters. So technological filtration, of course, starts often at the level of the search engine. So many of us searching for information online might not be aware of the fact that the search tools that we rely on use sophisticated algorithms to filter our results for us and adjust what we see based on a variety of factors, including things like our geographic location, what we've searched for in the past, and what kinds of content we've previously engaged with. So we might want to think about skipping Google and going to a healthcare database like PubMed, where at least there's more transparency and rigor in terms of how information is selected and shared because of processes like peer review, which are themselves, of course, filters. Individual actors can also be filters. So we know that commercial and government-sponsored media have played a very important role in synthesizing and highlighting information, especially information that may be more locally relevant. And organizations can serve as filters. So we see many institutions passing on information to their members through things like email and other alerts. And finally, of course, social media is playing an increasingly important role in what gets our attention. So a recent StatsCan study showed that more than 90% of Canadians who use the internet are accessing COVID-19 related information online, and that for 30% of these, their primary source of news is in fact social media, which is a bit of a problem. So in 1710, Jonathan Swift highlighted the fact that lies seem to spread faster than the truth. And in 2018, researchers at MIT released a study showing that fake news sped 6 times faster and penetrated farther, deeper, and more broadly than the truth, no matter what category of information they looked at. When it comes to COVID, we know that 96% of Canadians who use the internet are aware that they've been exposed to misinformation online. And of course, we know the true number is probably 100%. And in fact, about a year ago, the World Health Organization began using this term, the infodemic, to capture the challenges associated with this. And they really differentiate between information, which is accurate to the best of our knowledge, but evolves over time. So we can think about how, for example, perspectives on mask use have changed over the last 12 months, and misinformation, which is false, but not created with the intention of hurting someone, and disinformation, which is knowingly false and intended to deceive for some purpose, like selling a product or sowing dissension or undermining confidence in the state, for example. And of course, there has been just an overwhelming flood of false information about every aspect of COVID-19, from its origin to potential cures or treatments, and now, of course, vaccines. And we know that on average, only 16% of any misinformation is ever actually debunked. So what this leads to is this very chaotic, quite distorted, and highly alarming information environment. And we know that the more time that people spend on social media, the more we see increases in distress and mental health symptoms, and the less able people are then to critically evaluate the information that they're seeing. So for healthcare workers, this has created a whole host of new challenges in terms of relating to patients who may be really identified with some of these theories, and in determining for ourselves what we need to be paying attention to. So what can any of us do about this? Well, one thing is to really actively control our information consumption rather than letting it control us. So you might start by thinking about creating your own filters. Research shows that it can be very helpful to look at restricting your sources of information to just a few key sites or resources you know to be reliable and trustworthy. Many people find that, limiting the amount of time that they spend checking for information can also be valuable. So either setting a timer or deciding ahead of time when you're going to check during the day, and really restricting your checking to just those particular times can be effective. One thing that also helps is eliminating things like alerts and push notifications, or even potentially deleting or moving apps that may be tempting onto a different screen so they're not the first thing that you see when you turn on your device. And what this can do is help reduce that automatic impulse to check for the most recent updates, and it can help eliminate what we call purpose drift. So this is what happens when we pick up the phone to check an important information, or to respond to a call or look something up, and then we just happen to see that there's a headline that catches our eye, or there's some new updates on a particular app, and we just pop over to check in for a minute, and the next thing you know, we've spent half an hour going down some kind of internet rabbit hole. Now, of course, we can't avoid all news, and we wouldn't want to, but we don't need to treat all news equally. So helpful questions that you might consider asking yourself are things like, do I need to do this, or do I need to know this in order to do my job today or this week? Does this message actually require a response from me? And how is checking this information helping me, or conversely, how might it be harming me? So it can be really useful just to sort of check in with yourself about how you feel after engaging with a particular site or resource. And if you're feeling inspired and empowered, that's great. But if it's making you feel more anxious or more hopeless, there's that phenomenon of kind of doom scrolling, then it might be helpful to reconsider this behavior. Um, and it's important to recognize that for many of us, when we're looking for information about COVID-19 online, we're often trying to get some sense of certainty or reassurance or control. And what we actually find is that the more time we spend checking information, the more confused or unsettled we tend to feel. We might also find that we're looking for something like support or validation. And while online communities sometimes provide this, there can be more efficient or more effective ways to get that need met. So overall, it's just important to be mindful about when and how we engage with COVID-19 information, and how we choose to disengage. So finding realistic times to protect, or with realistic ways to protect time to think about, talk about, become really absorbed in activities that are unrelated to our work or COVID-19 can have enormous benefits for us in terms of our emotional well-being and our fatigue levels, as well as our ability to be present and engaged at work when we need to be. So things like spending time in nature, physical activity, and creative pursuits can be especially good ways to refresh and restore ourselves. And it's important to remember that time that we spend kind of looking things up online or going through our emails is by definition time that we're not spending doing these other things. And for healthcare workers, one thing that seems to have been particularly important is finding other things to do on our breaks. So for many of us, social media in the past was a place where we would go to connect with people or maybe to watch a funny cat video, but overall, we're looking for distraction from our work, but because of the ubiquitous nature of COVID-19 coverage, it just often isn't possible to avoid this. And so other things that people have reported finding helpful include things like, reading or listening to ebooks or podcasts, going for a walk, even playing games on their phone as an alternative. It might also be important to let others know what you need from them. So this might include things like redirecting family members who are asking you for information to good websites, or letting people know, in a kind of more assertive way that you need a break from talking about COVID and would like to focus on other things during your time together. You might also just want to think about reevaluating your relationship with technology overall. So it's often useful to start by doing some self-monitoring, and many devices readily supply this information, or there's a whole host of apps that you can download that will break down when you tend to go online, the sites you spend the most time on, and so on. And it can be quite shocking to look at these numbers, but once you have that information, you're in a much better position to take control of your information diet. And many people find it very helpful to just take a temporary social media break in order to kind of reset themselves. It can also be beneficial to create blocks of time when you're not available or harder to reach. So some people report finding driving mode or do not disturb mode can work well, because people who really need to get through to you urgently can still do so, but it just creates a bit of a barrier and it stops you from seeing those distractions and alerts. And we certainly recommend establishing kind of a cutoff for technology in the evening, ideally at least 30 to 60 minutes before you go to bed, and first thing in the morning as well. So even just giving yourself 5 minutes to brush your teeth and kind of stretch and take a few breaths before you log on and start checking can have real benefits for mental health. So just a few resources I'll highlight here. The Canadian Psychological Association has produced a fact sheet for frontline healthcare providers. That's available there. Science Up First is a new initiative. It really aims to it's very interdisciplinary in nature, but scientists, science community, people, healthcare providers, all coming together to promote and to amplify really good evidence-based information online, and particularly on social media. So it's a wonderful community of people, really worth connecting with and checking out. World Health Organization, of course, has resources around information overload and healthcare provider well-being, as well as tips for navigating the infodemic. So those are a few things that may be worth taking a look at. And just a final thought, that in a situation like this where, so much of this is out of our control, we can't control how many emails we get, through our work. We can't control whether new variants emerge or how effective vaccines are. But one thing that we do have some control over is whether we can set some boundaries around the information that we choose to consume. And so this is a good place to put some time and effort for yourself and for your own well-being. So thank you very much, and I'm happy to take any questions now.
Thank you, Dr. Holmquist. That was challenging, I think, for those of us who go on social media and tend to pick fights with people who are spreading this information. Guilty as charged there for myself. I'm sure I'm not the only one here listening who's experienced that and who's decided to spend some of their time doing it. But you're absolutely right.
And sometimes it's necessary, right, to do some of that. Like it's
Yeah,
hard to just let that stuff be.
It is, and your commentary on only 16% of that kind of information is ever debunked is, well, that's unfortunate, and I'm sure that probably contributes to how a lot of us have been feeling lately. And I think that your advice has been very timely for a lot of us, myself included. Um, we do have questions coming in. One question here already, and I'll just remind people, if you have questions for our speaker today, you can use the panel on the side to ask them. So here's the question that's come in so far. Often as we have to update scripts related to training new staff based on evidence. As we know, information changes quickly, and as a result, our training material must change and be consistent
Yeah.
across many environments. Being the keeper of factual info can be stressful, especially during the cross-checking phase. As soon as the info is updated consistently in all areas, it changes again. What
Yes.
would you suggest might be a coping strategy that promotes resiliency?
Oh my goodness, that is such a great question. And yeah, it's incredibly challenging. And I guess a few thoughts that I have. I mean, the first thing is a coping strategy that promotes resiliency is I think the self-compassion is so important with this. This is, this is often an enormous extra thing that's getting added on top of people's other work. And so one thing that I think organizations can do or units can do is to actually think about if you have one person whose job it is to be responsible for this kind of updating, is there anything else that could be taken off that person's plate to recognize and to value the importance of that work? So if there are other folks who aren't doing that, can they take over some other roles or other jobs to really have one person who's designated to focus on this and make sure that they have the time and the resources to actually do that work instead of expecting it to be an additional thing that you're doing on top of everything else that you're doing. But that's more of an organizational level change. In terms of an individual change, I think the self-compassion is important, just recognizing like we can only do the best that we can do. For information that's being updated regularly, I think it's really valuable to put the date, like, updated as of X on the bottom so that people will know, even if it's a month later, what you were doing was current as of the time it was done. Um, so those would be a few things. I think also just recognizing if this is something that's becoming overwhelming, is there any way to share that burden? So does it have to be just one individual, or can multiple people rotate doing those things? Is there one thing I think we found early on in my program, in my department, is that there was a lot of people individually searching for certain things, but that information wasn't really being shared amongst ourselves. And so there was a lot of reinventing the wheel that was going on. And so we actually created like a Google spreadsheet of resources, and everybody was able to edit and add to that within our kind of our own faculty. And that was really, really helpful because other people had come across things that I hadn't seen, and I was able to share things that I found. So there wasn't this work being constantly duplicated by multiple people. So I think to the extent that it's possible to avoid duplication and to kind of share that work more broadly, I think it becomes more sustainable and more manageable. But certainly I think that leaders and organizations need to recognize that this is an enormous extra burden that we're asking people to do, and there has to be some way to either free up time for them or provide sufficient resources and support so that they can do this without um, feeling overwhelmed by it.
It's a little challenging to stay abreast of current medical information regarding a pandemic in the middle of that pandemic off the side of your desk.
Yeah.
Uh, it's a full-time job, I think, for sure, for a lot of people. So that's good, both personal and organizational advice there. Another quick question has come in. Someone asks, do you mind saying the website you mentioned that we can find useful information? They said the Canadian Association, dot, dot, dot. I think that might be referring to the Canadian Psychological Association you mentioned.
That may be the fact sheet that, yeah, so it's linked. I'm assuming the slides for this will be posted, so hopefully people will be able to see that. But yes, Canadian Psychological Association has a fact sheet for healthcare workers.
Mhm,
Um, so that's probably the one. The other two sites were the Science Up First and then some of the WHO stuff around the infodemic.
mhm.
Yeah.
Well, that looks like all the questions that we have for today. I'll just keep an eye out in case one comes in as we're wrapping up here, but just wanted to thank you, Dr. Holmquist, for coming today. It was timely, it was educational, it was challenging. I hope a lot of us go home tonight and leave our phones on the charging stand for a little longer than usual
Yeah.
before we wade into the comment sections to do battle again.
Yes, and I can say if you're someone who does tend to wade into the comment sections or who likes to do battle, the Science Up First community is fantastic. Timothy Caulfield did our grand rounds last month for our department, and he is one of the people who's right at the head of this. And if you've ever read any of his work, and he is just passionate. He's been studying disinformation for 20 years, and he says he has never seen anything like this last year. So it's a Canadian initiative, so bringing together people who really care about this and really, again, instead of everybody doing it in isolation, really amplifying these common messages, I think is a way to make sure that you're having a maximum impact with the time that you are spending doing that, as opposed to feeling like it's a battle you're waging on your own, right? And there is that camaraderie that you feel in seeing and connecting with others who are engaged in the same struggle that you are. So
Hmm.
that's another benefit to connecting with a community like that.
I agree. Well, thank you so much for coming today, Maxine, and for everybody else who joined us. We appreciate your time. This video will be available on Shared Health's website in the future, and we look forward to seeing you at future booster sessions. Thanks again.
Thank you.